Hello, I'm Vanessa Taylor, and this presentation is about the ACCEND programme and the ACCEND Career Pathway, Core Capabilities in Practice and Education Framework. ACCEND stands for the Aspirant Cancer Career and Education Development Programme and focuses on the nursing and allied health professions workforce who have a wealth of knowledge and skills that play an essential part in delivering the best care for people affected by cancer in general and specialist cancer services across primary, community, secondary and tertiary care. Cancer is a complex and significant disease. At the same time, the diagnosis, treatment and management of cancer are becoming more complex with the advancement of scientific and technological innovations which have the potential to transform our ability to prevent, diagnose, treat and care for people affected by cancer. In order to meet the ever-increasing and complex needs of people living with cancer now and in the future, we need to develop and invest in the workforce who provide that complex care to people affected by cancer and address key issues. The ACCEND programme responds to a number of reports published over several years from NHS and charitable organisations. These identify a number of issues. The lack of a nationally agreed competency and skills framework for cancer nurses and allied health professionals, the absence of a competency and skills framework specifically for clinical nurse specialists, the absence of a defined career route for a nurse or allied health professional to have a career in cancer care, and the need for a stronger focus on succession planning for specialist cancer nurses and allied health professionals. Today, these issues remain and require urgent action, and the ACCEND programme seeks to provide a clear and structured career pathway for the nursing and allied health professional workforce who provide that care to people affected by cancer. The ACCEND programme commenced in autumn of 2021, aiming to provide guidance and direction on the knowledge, skills and capabilities required by all nurses and allied health professionals, caring for people in both general and specialist cancer services and roles as part of multi-professional teams across the 4 UK nations. The overall purpose of the ACCEND programme is to provide that clear and transparent guidance and direction around the knowledge, skills and capabilities required by the supportive, assistive and registered nursing and allied health professional workforce across the 4 UK nations. The ACCEND programme seeks to address and provide solutions to some key issues that challenge the cancer workforce both now and into the future. The ACCEND programme has a number of work streams that you can see here numbered 0 to 4 that focus on the different workforce groups and members. Work stream 5 focuses on the development of a national career pathway, capabilities in practice and education framework for the nursing and allied health professional workforce at all levels across the 4 UK nations. It is this framework which the remainder of the presentation will focus on, and information about the other work streams is available on the ACCEND web page. The ACCEND Career Pathway, Core Capabilities in Practice and Education Framework is available from the 17th of January 2023 on the ACCEND website, alongside additional supporting information including implementation guides for a range of users. The framework helps to promote and support workers, pre-registration learners and registered nursing and allied health professionals who work in both general and specialist cancer services, caring for people affected by cancer. A working group with representation from different professions, services and organisations all contributed to the development of the framework, supported by an expert advisory group, and you may also have provided us with feedback during the consultation period for the framework. The framework is made up of 3 components. The first is a career pathway. The second component is the core cancer capabilities in practice, and the third component is the education framework. The 3 components all fit together like pieces of a jigsaw. The career pathway, the first component, sets out 7 career levels for the workforce who provide cancer care in both general and specialist settings and services. It gives insight into the knowledge and characteristics required to work at each level, from the supportive level through to the assistive and registration and enhanced and advanced to consultant level practice. Practitioners can see the ways in which they can progress in their career. The core cancer capabilities in practice are the second component. These describe the core capabilities for each of the levels of practice necessary for safe and effective care. This provides a supportive structure for practitioners to develop and evidence their knowledge, skills and behaviours, and in the future will be supported by an e-portfolio as part of the ACCEND programme. The education framework is the third component, setting out the minimum standard for the knowledge and understanding about cancer and care of people affected by cancer expected by each level of practice. Learning outcomes and indicative content are provided for core knowledge and understanding, and also to underpin the relevant capabilities in practice. Learning outcomes are identified for pre-registration learners to have achieved at the point of registration, and we have developed e-learning resources to support pre-registration programme teams with these. The depth of knowledge and understanding required by nursing and allied health professionals following registration to consultant level roles in specialist services can be developed from this core knowledge and understanding along the career pathway to include post-registration continuing professional development, postgraduate awards, and also aligned to national requirements and frameworks for advanced and consultant level practice. The 3 components of the framework can also help the broader healthcare team alongside individual practitioners and professionals. For commissioners of service, it sets out clear expectations of staff, and for employers and service managers, they can use the framework to inform workforce development. It also shows that the workforce that are employed meet the core knowledge, understanding and capabilities in practice, or enables them to put development plans in place by supporting appraisal and continuing professional development. This all ensures patient safety and high quality service provision. For education and training purposes, providers can use the framework to audit, review and inform their curricula, and supervisors at all levels can use its structure for assessment in practice. Finally, for people in local communities affected by cancer, the framework outlines what they can expect from practitioners and registered professionals across all services. This framework sets a standard and offers pathways for the development of the workforce who provide care to people affected by cancer. So regardless of level or background, the workforce has the support to provide high quality, personalised care and to plan and develop their career in cancer care. To read the framework and to access a range of implementation guides which have been developed to support and promote the use of the framework, you're encouraged to access the ACCEND website. The implementation guides include a wealth of resources, and other resources are available on the site which will be regularly updated. Please look out for opportunities to participate in roundtable events in spring of 2023 and opportunities to share your implementation ideas and experiences. Thank you.